you have the okay. So let's talk about hypoglycemia. So already I told you that this is a brain need glucose and oxygen every time. Okay. In the stroke also I discussed that the arteries which bring glucose and oxygen to the brain is ruptured or maybe blocked. Okay. So here in the blood vessels are okay. But in the blood vessels, the glucose level is less. Oxygen is level is good. If the oxygen level is also low, that is also fatal to the patient. So we need to improve the glucose level in the body. So what are the whenever a patient come to your clinic or an hospital, so what type of things you will get to see that the patient is confused. Okay, you can see that the patient, if you ask some questions, whenever a neuro disease patient come to your clinic, you have to ask 3 to 4 questions. One is to understand his neurological disorder. First is ask his name. Okay, ask timing and ask them to lift their hands and legs. So if all these are proper, means his neurological behavior is in normal condition. Okay. But when you ask, he is not giving proper answer. He is thinking that is in his confusion stage. Okay, this is the confusion. Second level of thing is altered level of consciousness. Means the patient is in not in deeper sleep, not in conscious level. He is in mid of the stage. If we treat, he will regain the consciousness. If we the patient doesn't get proper treatment, he will go into the coma. Okay, so it is the between the stage of both consciousness and coma, that is altered level of consciousness. And the third is that is seizure. Seizures means there are number of types of seizure. We will discuss in neurological diseases that the patient will have stiff hands and legs and he is having frothing from mouth. Okay, and there is chances of tongue bite and he have the eyebrows or eyes can lift up. Okay, so this is the signs of seizures. Okay, we have different types of clonic seizures, tonic clonic seizures, different types of seizures. So we will discuss in neurological diseases in detail. Okay, so these are the simple and most common types of medical science or clinical science you will see in the hypoglycemia. Okay, so what happened will in the hypoglycemia, the insulin levels are high because insulin is the most important hormone which controls the entry and exit the entry of glucose into the cell. So this is the door in which the of carbohydrates means glucose will enter into the cell. If they are low, what will happen? If they are high, sorry, if they are high, what will happen? The large amount of glucose will enter into the cell. Okay. Because if we enter into the cell will make this into energy and it will utilize it. So we have normal storage level of glucose in the blood vessels also and as well as into the cell also. So if it's less than normal level, it means the insulin is utilizing more glucose. The problem in the insulin, first thing. Or else we have problem into our some of the hormones like catecholamines, glucagon, growth hormone, or cortisol. So these are the hormones, okay, which works for metabolism. Okay, so metabolism is occurring morely. So that's the reason cell is utilizing more glucose. So the level of glucose in the blood vessels are decreased. So how can we name that this person belongs to hypoglycemia? So we have plasma glucose level that is less than 45 to 50. If we checked into the blood glucose level is less than 45 to 50, it means that this patient having hypoglycemia. But some doctors will say, no, this is not for every patient. Some patient will have 50 milligram of uh, glucose or blood sugar level, but they are normal, some patients. But some patients have clinical features like confusion, altered level of consciousness, seizures, everything. So basically, it is depend upon the symptoms which occurs to the patient. You have to define that this patient belong to hypoglycemia. But mostly below the 45 is considered as hypoglycemia. Understood? So let's talk about the reasons. So I think we understood about what is glucose, why it is necessary. Okay, what are the some clinical symptoms? Now, in detail, we are in the etiology, reason behind the hypoglycemia. Mostly is the drugs. Mostly, the number one cause of hypoglycemia, that is drug. Drug means insulin. So the number of patients in our India taking, not in our India, globally, worldly, okay, they are taking insulin. Morning 20 units, afternoon 5 units, night 20 units. There are different types of insulins, fast acting, long acting, short acting. Okay. So we'll talk in. Okay. So don't know about seizures. Don't worry about that. We will talk in detail in neurology. But here we are talking about hypoglycemia. Okay. So if anyone have doubt, we will ask in last. Okay. Here, drugs means they are taking insulin. They are taking insulin. So insulin is most common worldwide using by the patients of diabetic mellitus. So what we have short acting, which will work for 6 hours, long acting, 12 hours, very long acting, that is slowly sustainable. Okay. That is 24 hours. So there are different types of insulins which will work. Okay, they are the reason for hypoglycemia. Okay. Second is the cause of any hepatic, renal, or cardiac failure. So this is also common. This is also reason for hypoglycemia. It may be liver problem. It may be kidney problem. It may be heart problem, which causes hypoglycemia. Okay. Second is deficiency of hormones, adrenal hormone, okay, or hypopituitarism. Pituitary gland is not working well because it will control, it is the master gland, it will controls all glands. Okay. So these are the reason. One first reason is drugs. Second reason is critical illness, past history of chronic diseases like hepatic liver disease, like kidney disease, like heart disease, or other diseases, or hormone deficiencies. Okay. Hormone deficiencies, or insulin is releasing by the pancreas. We have the pancreas below the abdomen. It works as endocrine gland or and exocrine gland. Endocrine gland will release three. They have three cells: alpha, beta, gamma, delta. Beta cells release insulin. Okay. Beta cells release insulin. So here, what happened that in the beta cells there is an issue. Okay. So there's the reason also we have hypoglycemia, or else any autoimmune disease. Those large amount of insulin is produced by the pancreas. Okay, this is also reason. And there is a oxidization, gluconeogenesis, means large amount of glucose is utilizing by the body. This is also a disorder, or excess exercise Excess exercise, are you doing exercise regularly without eating food, without taking any small amount of meal, anything? You're taking excess amount of food or excess amount of exercise you are doing. Okay, that is also a reason, but it is short-term reasons. Long-term reasons are hepatic, renal, cardiac, or insulin resistance, or insulin beta cell tumor, or sometimes accidents because of the loss of the blood. It will cause hypoglycemia. Okay, so these are the causes which will related to the hypoglycemia. Already I told you the clinical features. Now we discuss in detail here. So it has some autonomic or neuroglycopenic uh, signs. Okay, autonomic means whatever in the brain, every body part is related, it is connected to the brain. Some are in our hands, some are not in our hands. Okay, like we want to raise the hands, it in our hands. We want to walk, we want to talk, we want to see, we want to everything, it is in our hand. But respiration, it is not controlled by ourselves. Heartbeat, it is not controlled by ourselves. Like digestion, everything like this is not controlled by ourselves. It is controlled by the brain. It is autonomic. It is automatic. Automatically they are controlling. So whenever brain problems occurs, there is a slightly changes in autonomic nervous system, like heart rate, because the glucose is decreased to the brain, so the functions also decrease. Simple. Heart rate decrease, respiratory rate decrease. Okay, everything will decrease. So this is the thing. This is the one sign you can see it. It may be decrease, it may be increase. Okay, anything will happen. BP. Okay, and neuroglycopenia means it is wholly related to the nervous system. Okay, that's like behavioral change. I already do confusion, fatigue means unable to walk, unable to lift the hands, like raise down, and just he want to sleep, or he or she went to deep sleep. Also told seizures. Seizures means it is a abnormal wave is coming from the brain. Okay, and it will end up by the upper and lower extremities. Okay, will affect the upper and extremities means limbs, hands and legs. Okay, so the patient will have signs according to the area of the brain affected. Okay, seizures also will happen. Loss of consciousness. Okay, if the hypoglycemia is severe, the patient will die. So we have two types of symptoms: neurogenic, neuroglycopenic, or autonomic. Okay, so I think you understood. So here the glucose level below 2.2, which condition, which glucose levels are there? So mostly 40 to 45 to 50 is the accurate. You can tell them. So what are the diagnosis? How to diagnose hypoglycemia? So basically we will take the blood sample and we will send to the. So how to diagnosis? So basically we'll take the sample and we'll check random blood sugar levels. Okay. Mostly this will do in the hospitals. Additionally, you can see the C-peptide levels, insulin levels. This is for hormone, to check the hormone, to check the liver, okay, or to check the other related things, okay, or hormones deficiency is there. Okay, according to the condition, I will see. Okay, so now treatment part, basically, uh, in this condition, the administration of glucose bottles, it will be done by orally. If the patient is conscious, he is seen, he is semi-conscious, we can give orally glucose. Okay, fruit juice, chocolate, sugar will improve the carbohydrates in the body, or else we will give IV. Okay, 5%, 10% dextrose, it will be given in the hospitals. Okay, by observing the glucose levels. Okay, hourly, half an hourly, they will check the glucose level in the body. If the glucose is in normal condition, they will stop the IV and will observe for 24 to 72 hours in the hospital that his glucose is maintaining or not. If the glucose is maintaining, so what is the cause? They will try to find. Okay, then they will treat the cause. So mostly in this condition, only IV administration is given in the most severe hypoglycemia. If normal, moderate hypoglycemia or mild hypoglycemia, we can give orally. Okay, and we have to observe glucose level or every hourly or every second hourly for 1 to 2 days. Okay, then check the hormones, kidney, liver, cardiac problems, or insulin issues, pancreatic beta cell issues. So we'll see all this and we'll check if there is a problem in this list. We'll treat the organ or the area, but the patient will have improvement. Okay, so I think this is all about hypoglycemia. This is the all the signs, clinical features, what is the problem, how the problem occurs, were discussed in detail. So I think we completed emergency medicine. Okay, from tomorrow, these are the 4 to 5 diseases I explained here, because all those things are related to hospitalized condition. So, so there is a reason I can't explain here. Now we have the general diseases. We will discuss how to treat electrohomeopathy also, like common presentations. This is the common diseases. In this, we will discuss in treat in electrohomeopathy, homeopathy, like fever, okay, or other condition like cough, abdominal pain, nausea. All these things can be treated in electrohomeopathy because these are the not emergency. Okay, so if any doubts, kindly ask.